The Americans took dramatic steps to keep Ebola out of the United States today. Screeners at New York's JFK began taking the temperatures of passengers flying from Ebola-ravaged countries in West Africa. The Canadian government is also stepping up its efforts to fight the spread of the disease. But as Arthi Pol reports, those measures will do little good if the world doesn't do more to fight Ebola at the source.
Working around the clock to set up a field hospital in Liberia, 25 new beds to treat Ebola patients. A drop in the bucket as the disease strikes thousands in West Africa, but a start.
This will give people, the healthcare workers, hope that if they go in and they contract this deadly virus, they can be treated here.
Ebola is spreading at an alarming rate, now not limited just to West Africa. With the U.S. recording its first Ebola death last week, it's one of several countries answering the call to ramp up the Ebola response. Today, an enhanced Ebola screening program began at New York's JFK Airport, the first of 5 U.S. airports to provide the extra testing. Travelers arriving from Guinea, Sierra Leone, and Liberia will now face questions from representatives with the Centers for Disease Control, and their temperatures will be taken. But the U.S. CDC warns the extra measures can't guarantee Ebola will be kept at bay.
We can't get the risk to zero. That will not be the case, but this additional layer should add a measure of security and assurance to the American public.
The new measures wouldn't have identified Thomas Duncan, the patient in Dallas who died from Ebola. He didn't have any symptoms while he traveled. Meanwhile, travelers in Canada will see similar enhanced screening at 6 international airports. And the government is also telling the more than 200 Canadians living in West Africa to think about coming home.
Should any Canadian require medical evacuation from the Ebola-affected regions, there are limited services available, and the Government of Canada cannot guarantee access to these services in another country.
Patients can survive Ebola, but good treatment is essential. Most patients treated in the U.S. have recovered. In Spain, 17 people are being monitored at this Madrid hospital, along with an Ebola-infected nurse. While there's still no cure in England, researchers are conducting safety trials for a vaccine on 60 people who volunteered to help.
This is really sad what is going on out in West Africa. And what could I do?
Test results are expected in 4 weeks, and if it's safe, 20,000 shots could be ready for use early next year. Too late to affect the current outbreak, making the need for immediate action from the rest of the world all the more critical. Arthi Pol, Global News, Washington.